The American Cancer Society estimates that more than 62,000 people in the United States will be diagnosed with kidney cancer this year. One of the 10 most common cancers in both men and women, kidney cancer typically strikes those around the age of 64, with renal cell carcinoma being the most common type. Kidney cancer starts as a mass on the kidneys and is especially dangerous because it's hard to detect.
The masses are most often undetectable. We don't know that it's occurring. It can exist for months to years prior to diagnosis. The presentations are relatively common in that they can cause flank pain or bleeding when you urinate, but unfortunately most patients with kidney cancer rarely have these presenting signs and symptoms and are often found with imaging on a CAT scan, a physical examination, or an MRI.
Risk factors for kidney cancer include obesity, smoking, workplace exposures, and certain genetic disorders, among others. While the causes of kidney cancer aren't known, there are those who seem to be more susceptible.
Men develop kidney cancer more frequently than women, with a ratio of about 2 to 1 in the United States. There are some very specific predisposing conditions: smoking, obesity, exposure to certain chemicals that we ingest or are exposed to, or hereditary and familial changes. But unfortunately, the reality is that most patients that develop kidney cancer have what's called the sporadic type. Sporadic meaning that we really don't know the cause of why they developed it individually.
But there is good news. New research presented at the annual meeting of the American Society of Clinical Oncology shows there are new treatments to target kidney cancer.
We have agents that are what are called targeted agents that block certain pathways that are known to cause kidney cancer cells to grow. And we finally have agents that alter our immune system's ability to search out, find, and destroy a kidney cancer cell that had not been present previously, that allows us now to talk to patients and present it at the ASCO meetings in 2016, showing that we can now extend life. And extending life from a targeted agent or extending life from an immuno-oncology agent now 3, 4, 5 years longer than we would have otherwise expected is a dramatic change for patients that suffer with this disease.
While the diagnosis of kidney cancer or any other type of cancer can be scary, some of the best treatment options are available right here in our state.
California has wonderful resources through our comprehensive cancer centers in Los Angeles, in San Francisco, and throughout the state. You can use the American Society of Clinical Oncology website, the University Comprehensive Cancer Center's websites, and most importantly, be a strong advocate if you're a patient or a family member, and identify resources and people that have great expertise in this disease if that's what you're struggling with.
And as always, regular checkups with your personal doctor is the best way to identify and start treatment of any illness. Bringing you the best of California, I'm David Wiley for California Life.